All right, well, I'd like to welcome everyone back. Before lunch, we heard Rafael Bostic provide a wonderful overview for today's second topic, community development and population health. And our session moderator, Jose Montero, will now introduce for us the second panel of the day. So I'll give the floor to Jose.
Good afternoon, everybody. I was a little confused, but I think that Terry made the executive decision that we are following that clock, correct? So, because if I look at my phone, then we are already a few minutes behind, so I don't want to take any time away from the panel. So, as the previous speaker said, we all use different definitions. Let's that one be our definition of time. But that's a really important point as we advance this discussion in the social component of how do we modify what we do at a community level so we can improve outcomes and improve health. We really need to know what we are talking about, with whom, what the boundaries and what the expectations are. We keep talking about money, and I had one of these brief conversations during lunchtime. What does it mean reinvest the money? Whose money? My money? Because if I am a hospital, that is my money, and you are not going to reinvest my money. But if I am a public health agency, that's my budget, and you are not going to reinvest my budget. So whose money are we going to reinvest, and how do we develop a community in that sense? So we heard really great things earlier today from our speaker, and he clearly said that there is a role for government in these pieces, that from government we can look at interagency coordination, we can provide guidance at different levels of the structure, but certainly we can help with the development of rules that change the game. But we will do that change from the top down, and that will only work if we have a component that does it bottom up. So we can meet somewhere and really engage in that process of community transformation. And we cannot forget what history has been telling us, where we come from, which applies clearly and certainly to housing. But it does apply to everything that we do in medical care, in healthcare, and in public health policy as well. And we have perfect examples of that on tobacco or lead or other things that may have had this great impact in health. So in order to continue the discussion and show great examples of what is going on at the community level, we are going to have two terrific speakers. Hold your questions until they have had the chance to do their presentations, and then the three of them will answer whatever questions you have. Even David's questions of what is the money, how much money it is, and who has my money. They will be able to address those things after the presentations are done. Their bios, which are quite impressive, are part of the package, so you can read those there. So we will hear initially from Donald Hinkle-Brown. Mr. Hinkle-Brown is the president and CEO of the Reinvestment Fund. And then after him, we will hear from Nancy Andrews, who is the president and CEO of the Low Income Investment Fund. So please join me in welcome initially Donald.